I'm Dr. Jayanthy Ravindran. I'm a board certified plastic surgeon. So I specialize in aesthetic work, both surgical and non-surgical. One of the commonest problems that all of us face. Sometimes I have got some clients, patients who tell me, I am 45, 50 years, I've never had acne before and I'm developing acne now, because they all think that acne can come only in the adolescent age group. That's not so. So why do we develop acne? So as I was discussing before, I want you to think back on the skin anatomy. So we have this hair follicle, the hair shaft coming out through the pore, skin pore, and we have the oil secreting gland, which is called the sebaceous gland, and they secrete what is called sebum, and that opens into this hair follicle. So what happens? So whitehead. So there is sebum secreting into this hair follicle, and it is not shed out. It's more than what is required to actually coat the skin or the hair. So it collects within that, because the duct taking the sebum out is blocked, and so the pore is still open, but you're able to see the sebum inside. So we call it's a whitehead, or a whitehead is also called a closed comedone. Then blackhead. So the blackhead is the same sebum. When because of oxidation of the melanin, it becomes black. So when you see through the pore, you are able to see something black inside, and so we call it as blackhead. Sometimes we also mistake blackheads for ingrown hair or broken hair shafts. Then when we try to remove them by extraction, it doesn't come out. So that's when laser helps. So one of the differential diagnoses when you have blackhead is actually you can have an ingrown hair or a broken hair shaft. Then these sebum, if they get acted upon by bacteria, and then they develop what is called a papule. Initially, when the sebum is collected, there is an inflammation. So just the inflammation without bacteria will produce what is called papule, because a lot of blood supply around that area. So you see a red color bump, and we call it as a papule. It's still not infected. But when that papule becomes infected, it becomes pus. So then you call it as a pustule. So this is the process in which someone develops acne. So when someone presents to a physician with acne, all the acne need not be pustules, all the acne need not be whiteheads. So you will have acne, or you will have these sebaceous gland activity at different stages. So there could be some whiteheads, some blackheads, some papules, some pustules, or all of them could have healed, and then you might have only scars. So the treatment or the creams that you choose to handle each of them, they have to be different, because each pathology is different. So if it's a whitehead, you just need to release that blocked sebum. So an extraction or you open the pore with steaming can help. If it's a blackhead, it's oxidized. So apart from extraction, you need regular exfoliation so that it doesn't form again. If it's a papule, then there is inflammation. So you need some anti-inflammatory cream to correct this. When it's a pustule, you have bacteria, so obviously you need antibiotic, either oral antibiotic when there are many, and if there are few, topical antibiotic to handle all of them, right? Some of them, they become so big that papules, they become like a cyst. And when the body's own defense mechanism sometimes acts against this, then the infection goes away, but the cyst organized inside the skin, and that's when you have a constant bump on the skin. So we've taken our body has an immense capacity to fight against any infection. So over a period of time, it's automatically acne comes, and then the body fights against this and it heals. But while it heals, it can now again going back to the anatomy in the beginning. So we all know now the sebaceous gland is in the dermis. So obviously, if there is an inflammation of the sebaceous gland, that inflammation is going to continue into the dermis, where you have surrounding collagen tissue. So obviously, once it is all healed, the collagen is damaged because of inflammation, collagen and elastin tissue, and they end up leaving a scar. Depending on how the inflammation has been during the active stages, the scars also eventually develop to be different. So you have some scars called rolling scars. These are called rolling scars, box scars. Then it's like you take an ice pick and it's like you poke that ice pick into the skin. So that's when you look like ice pick scars. Some of them have a tendency to become hypertrophic or even keloidal. So you'll see a lot of people having thick scars over the chest or sometimes in the angle of the jawline, where they become very hypertrophic because the tension force is higher there. So how do we differentiate between each of these scars? So if you can stretch your skin, and if the scars actually, if you put 2 fingers on your skin and try to stretch the skin and see if the scars actually visibility decreases or increases. If it's a superficial scar, the rolling or box scar, they actually reduce in visibility. But if it's an ice pick scar, it becomes more prominent because it's deep. Now, treatment, when it comes to the stage of scar, it is impossible to correct all of them completely with any cream. Definitely, you will require some procedures to correct scars, but there are creams if you apply at the early stages. Yes, the scars can be remodeled, but not when they become extremely hypertrophic, keloidal or ice pick, when you need definite procedures to correct them.